A 17-year-old girl is brought to you for evaluation of absence of onset of menses. History indicates that she experienced growth spurts at the age of 11 and has normal breast and pubic hair development that began approximately years ago. She appears to be of appropriate height. She has no other medical conditions and takes no medication. She is not sexually active.
Next step, right? Okay,
Pelvic
remember,
examination is
there is a next step in management what they're asking you.
Pelvic examination to confirm whether
Very
there
nice.
is uterus or not.
Yes. Okay. Please remember they are asking you next step in management. Very good. Okay. Go on, dear.
Ma'am?
Yeah, go on. Yeah. Swapna.
Okay, ma'am.
Swapna
Yes.
was answering, no?
I'm sorry. Yeah, ma'am.
Swajanya, sorry.
Heavy
Sorry.
paratha खा के जी vomiting feel हुई है.
Kiran, can
Yes,
you please switch off your mic, dear? Yeah. Go on, dear.
A 16-year-old girl is being evaluated for primary amenorrhea. Breast development is normal. The uterus is absent. There is a blind vaginal pouch and the gonads are ovaries. Ultrasound is the diagnosis to rule out MRKH.
Ultrasound, I think they have done. MRI, brain, not brain, MRI, abdomen, pelvis needs to be done. Okay, they have already done ultrasound to know that uterus is absent and the gonads are ovaries. How can they know gonads are ovaries until unless they do ultrasound?
Okay, ma'am. Okay.
So the next step will be a MRI. Okay, to clear the picture because that is a gold standard for MRKH syndrome.
Ma'am,
Yeah?
Okay.
we have to do karyotyping.
Yeah, karyotyping.
We can do karyotyping, but before doing anything, you need to confirm that whether the ultrasound findings are okay or not. So that is why you'll do an MRI. Karyotyping also you can do, but you need to do an MRI to rule out first the pathology, confirm it, and then do the karyotyping.
So, ma'am, for every MRKH after ultrasound,
Preferably.
MRI.
Yeah, they preferably do to rule out that whether it is what exactly is a pathology by an MRI, which is a gold standard, and to come to the conclusion, okay, there is MRKH or not MRKH, they will do a karyotype.
Here the question was next step, but if they
Next step.
ask what is the investigation for you to confirm the diagnosis, then can we do
Then
karyotyping?
Yeah, then they will give you some details that okay, these investigations are done and this is the finding. So what will we do? Confirm that she is having the uterine abnormalities or malformations. Then you need to do a karyotype, definitely.
Okay, ma'am. Thank you.
Ma'am, why not hormonal profile here?
Because it is not required. No, they have given you the clues that uterus is absent. Breast development is normal. Breast development normal means definitely hormones are normal, no? Right? And they have already given you gonads or ovaries. That means they are functioning. That is why they are saying. Might be they are not functioning, then their breast development will not be normal. Okay? Make sense?
Yes.
Okay, these are few things where you need to know. Everybody who reaches 14, 15 years will have tenor stage 4 and 5. Okay, please remember the basic things sometimes we forget. And how to differentiate each one of them? Look, presentation definitely will have primary amenorrhea. In the patients with MRKH, their secondary sexual characters are well developed. In CAH, there are sometimes precocious earlier than the age they develop. AIS, breast is normal, pubic hair will be scanty and they will have swellings in inguinal area. POI, not well developed, nothing is well developed. Menses will be absent, uterus will be absent and ovaries will be okay in MRKH. Uterus, bilateral ovaries and adnexa are normal in CAH. Same, the ovaries are absent in AIS and POI, might be it is a Turner, then it will be normal. The ovaries will be streak ovaries. Otherwise, there may be small, they will not develop. Uterus may be small or not developed, or normal may be present. And among the karyotype, AIS are 46XY, everybody knows, and rest are 46XX. I don't know, but somewhere, just Mandia, long back somewhere, some people asked me about the LH receptor defects. How do they are seen? So, and swear. So, swear we know that there is a amenorrhea, secondary sexual characters will be okay, primary amenorrhea. Ovaries do not develop, but they are still 46XY syndromes. In patients with but they are not, secondary sexual characters are not normal, you can say, because estrogen is absent. So breast is not developed androgenic signs and symptoms will be okay. LH receptor defects will have normal late menarche followed by oligomenorrhea or infertility in future. Secondary sexual characters normal or late menarche followed by oligomenorrhea. USG will be normal because it is a receptor defect, so everything seems to be normal, but there is a receptor defect, so there will be problem with regard to our menses and fertility in future. Okay? Yes, dear.
Ma'am, in that question, to differentiate it from AIS, shouldn't we do the hormonal profile?
No. AIS will typically be perfect females with scanty pubic and axillary, where they will give you in the question.
Oh.
Okay. And always they will give you something. Like for AIS, they will give you, there are some swellings noted in inguinal area. For congenital adrenal hyperplasia, they will give you, okay, there are similar history of, there was an ambiguous genitalia at birth for which she underwent some surgery. Or she underwent some surgery and mother is not allowing you to do a pelvic examination, per vaginal and per speculum examination. Or there is similar history of the siblings having the same history. So you will come to a conclusion by the primary amenorrhea like that.
Ma'am,
Okay.
in swayers, because of the androgens conversion to estrogens, the secondary sexual characteristics are normal, ma'am.
No, they are not normal. Breast is not very good developed because androgens are okay. So somewhere, because adrenal is also there. So secondary sexual characters are not normal. Breast might not be well developed, but yes, axillary and pubic hair may be okay.
In the table, it is normal.
Yeah. No. I've just,
Okay.
that is why I clarified that breast is not good, not as well developed as for the age, but yes, pubic and axillary hair may be.
But why not, ma'am?
Okay.
The androgens get converted into estrogen. In AIS,
Not
it is
at-
happening the same. No?
Yeah, but everybody has their own signs and symptoms. So somewhere in their defects, they do not have good breast development. They are taller, not gross breast development, no menses, okay pubic and axillary hair, uterus present. Then AIS will not have uterus.
And AIS will have good breast development.
Yes, those are perfect females with lack of pubic and axillary hair with primary amenorrhea, swellings in inguinal area.
Okay, ma'am. Thank you.